Hi, it's Dr. Renee here at blackdoctor.org, and March is Endometriosis Awareness Month. So, we are going to have a really fabulous discussion with Dr. Yolanda Lawson about endometriosis. As always, sharing is caring. Please don't forget to share the broadcast. I don't care where you're watching from, make sure you share it on that platform. And also, please type in the chat where you're watching from. Thank you so much. And here's our guest. Well, hello, Dr. Lawson. Hello, Dr. Lawson.
Good morning. How are you?
I am great. How are you?
I'm well, thank you.
Awesome. So, as I said, Endometriosis Month. First of all, tell everyone about what you do.
I am an OBGYN specialist by training. And so I deliver women's care throughout the lifespan. I tell people all the time my youngest patient is age 3 and my oldest patient is age 99. So I manage women across the spectrum of their life, whether it's childhood and adolescent, gynecologic issues, pregnancies, menopause, and just all the things that we as women have to deal with and manage around our reproductive health and whole health that can be tied to that. And I'm also the 124th president of the National Medical Association. And the National Medical Association is composed of 26 medical specialties. We do have an OBGYN and a women's health section. And our primary mission is the elimination of healthcare disparities.
Lovely, lovely, lovely. So, endometriosis, I think in recent years, I've just been hearing more about it. Is it because now it's being diagnosed sooner, or what's the reason that now, like all of a sudden, I've been hearing so much about it?
I don't necessarily think that it's diagnosed sooner. I think one thing that happened while there's a bit more awareness of endometriosis in 2018, there were some new treatments. There were new treatments that came on the market for endometriosis. And with direct advertising by pharmaceutical companies around those new treatments came around the the condition in itself. It's been a long time noted condition that can affect women, and cause pain and painful menstruation in women. So that's likely why. And again, I think social media in this age, a lot of things that may not have been talked about. Key opinion leaders now have a channel, right, in which to amplify information.
So, let's back up. Can you explain exactly what is endometriosis?
Absolutely. So endometriosis is a condition that the type of tissue that normally is formed in the inside of our uterus, right? That tissue that generates our menstruation migrates to other portions of the reproductive system or the pelvis. Most commonly, it would like to affect our ovaries. However, it can lie on the surface of the uterus, the pelvic organs, which could include your bladder, your bowel, and it can cause scarring and pain, most notably pain during menstruation.
So, so many, I know, like I said, unfortunately, I know people personally who have struggled with it for a long time, and it took years for them to actually get a diagnosis of endometriosis. I just knew that they were always having stomach pains, and they were having pains all the time, and they were taking, I mean, serious pain medication, not just your average Tylenol. And then once they went inside doing surgical procedure, that's when they figured out it was endometriosis. So is that the only way to diagnose it, or is that one of the things that you use?
So I like to talk to women around the spectrum, right? And so we all know that our menstrual periods, we can get some degree of cramping and pain, right?
Yeah.
And if you talk to your girlfriends, your sisters, or your mother, that can range amongst us.
Right.
Typically that's normal, right? We're going to have
Mm-hmm.
cramps and some pain. And that's called dysmenorrhea. That means I have painful menstruation. When you have painful menstruation, there are reasons why you can have painful menstruation. One of those is endometriosis, right? So you can have just a spectrum of normal pain with menstruation, and you don't always have endometriosis. I just want to clarify that for the audience because I don't want anybody who thinks they have pain, they have this.
Right.
Second thing is endometriosis may be of a chronic nature. It's usually chronic. It can be disabling. These people may have a higher incidence of not being able to go to work and such due to the pain. We can't always diagnose it by an x-ray, ultrasound, or MRI. We don't always diagnose it. There are things endometriosis can cause. So one thing is an endometrioma. That is a collection or a type of mass or cyst on the ovary formed by endometriosis that you could easily pick up on an ultrasound and get a diagnosis right away. However, if it's one of the implants, that's not something you can visibly see. And so there are two ways we could diagnose it. It could be what's called a clinical diagnosis. That's based on kind of instinct, your exam, the history. We're using a multitude of information to do that, but we don't. I explain to people there are some disorders you can't go to the doctor today, like strep throat, and get a diagnosis, right? Because we also don't want to incorrectly diagnose you or prematurely diagnose you. This is a chronic disorder. You report that to your And so when we make this diagnosis, it may take time. So it's not unusual. It's not the type of thing you go in one time. I had a bad menstrual cycle
Mm-hmm.
and likely be diagnosed. You may hear doctors, and I correct patients all the time. They may say, "Oh, there's a possibility of endometriosis," but women only hear the word endometriosis and may think
Right.
that's wrong. So it is a diagnosis that lends to chronicity of the pelvic pain, severity of the pelvic pain. So sometimes we may make a clinical diagnosis. We don't always operate, right? And they may put you on treatments to see if you respond. If you don't respond, then people may ultimately need the laparoscopy or surgery to remove the endometriosis. So it's a diagnosis that
You back? Okay, you froze for a minute there. So you were freezing. You said so some people may need the laparoscopy, or and that's where you froze.
Yeah, some people may need a laparoscopy or another surgical procedure because when we do the procedure, we're actually looking, right? And we maybe take biopsies and tissue samples to confirm the diagnosis. And it really depends on the severity, right? Some people we may treat because they have the painful cycles and see if they respond. If they don't respond, you may ultimately need to go to surgery.
So the surgery, after the surgery, will the endometriosis be better, or that's just is it going to be better for 1 month, or is it going to be better all around, or
So So it depends. Again, as you understand, there's not many diseases that may be the same in one individual as
mm-hmm.
another, right? Even they may not respond to treatments the same as one another. It depends on what we have to do surgically, but primarily it depends on the stage of endometriosis, right? So we can stage it similar to like we stage cancer, like how
Right.
invasive is it? How widespread is it? What organs is it impacting? I have had people get a colon blockage from endometriosis growing in the colon of the bowel. Those women may have pain with a stool or a bowel movement. Some people, if it affects the bladder, that could affect. Some people may have pain with sex. Some people, it may only affect their menstrual cycle. So it does not necessarily look. So two women talking and discussing endometriosis could have a completely different symptoms,
Mm-hmm.
completely different treatment algorithms. You're right. It may depend on how it's impacting you as an individual. So surgery, if it's an endometrioma, I can completely resect it. Sometimes I can resect it off the ovary. Sometimes a woman may have to lose her ovary, right? There are treatments thereafter. I highly encourage when I operate on these individuals that we usually use some type of treatment. So even though I may go in and burn it or remove it or whatever I may do at surgery, there's always that risk of microscopic disease. And that means that disease that you can't see. It's at the
Mhm.
cell, right? You cannot see it, but you know that potential is there. And so that's why many times, even after surgery, we provide treatment because there's always a risk of recurrence. I tell people, once you have something, you have a propensity. I'll use the example. My grandmother grows a lot of moles. My grandmother gets moles removed, but that does not mean she won't grow another one, right? She has a propensity to do that. And the same thing when you have this disorder and many others. If you have that genetic potential to do that, there is that risk of recurrence. And that's why treatment is necessary.
And so, what are some of the newer treatments you were talking about? Some of the that's why we've seen so many commercials about it and hearing about it. So, what are some of these treatments?
So in the past, we had injections that we used and primarily birth control, right? Birth control pills or depot shot. And so we know through prior studies that estrogen containing or estrogen can help proliferate endometriosis. So many times we would use progestin only contraception. That would be most commonly known like a depot. It doesn't have
Mm-hmm.
components or even birth control pills such as that. And so we may use progestin based hormonal therapies are really one of the mainstays around endometriosis. And on 2018, some new hormonal therapies, which were in pill form, became available. It had not, and so this is one of my little soapboxes around when you look at disparities around women's health as a whole
Mm-hmm.
because of lack of investment, right, in women's health. A lot of times the research, the data collection is not there for women's health conditions. And
Right.
so, out of all the things that we're doing, it did take a long time for a company to get in, do the research and development, and get new products on the market, right, for this disease that really primarily disables women. When you think about what that disability and lost work and the economic triggers that this means. So, those drugs are really progesterone or hormonal based, but oral formats, because the only previous product we had outside of contraception really would have been the take pain meds or another injectable form. Primarily, the side effect with many of these are hot flashes, because again, you
Oh
heard
wow.
me say we're suppressing estrogen. And when you suppress a woman's estrogen, the physical manifestation are going to be hot flashes. And that varies even between the dosages or who that woman is and her age.
Okay. Okay. So, what's the youngest patient that you've diagnosed endometriosis in?
I would say in their 20s. Yeah.
Okay.
So it could occur in the 20s. For me to find it in an adolescent, not that I can recall offhand, is that going to be quite common? If you think about menarche, but even when you look at menarche, and when I say menarche, when a young woman starts her menstruation, that's becoming earlier, right?
Mm-hmm. Yeah.
So with nutrition and the things right now for humans, our nutrition, the body weight is higher in girls normally now. We see that commonly. So in essence, that causes the menstruation to be earlier. So I do think down the road we may begin to see it a little bit earlier, just because girls are starting their cycles earlier than what they used to do historically, if you look through historic timelines.
Mm-hmm. So the in the early 20s. So we've talked about fibroids at nauseum, of course, because we have to keep talking about them. But that's another place where they have dysmenorrhea.
Mhm.
So how does one figure out? I mean, I guess it's just going to the doctor, and that's how you figure out if you have one or the other or both. Maybe, unfortunately.
Absolutely. And so that's, you heard me mention previously at the beginning, outset of this, why people have pain. And so when you talk about pelvic pain, one of those reasons is endometriosis. One could be fibroids. There could be a multitude. It could be infections. It could be scar tissue from other conditions. So there's things going on with your fallopian tube. So the first you got to go to the doctor. Is it my ovary? Is it my tube? Is it my uterus? Because women tend to just point down there and say everything is their ovaries, right? It's my ovary pain. So people point all the time, and I'm like, I'm an OBGYN and I can't tell the difference between my ovary pain and my tube pain and my uterus. But okay. So it's just important to go and get properly evaluated. Don't expect answers always at the first appointment. Sometimes it takes certain diagnoses. It takes multiple months, re-examinations, x-rays, blood work. It takes a multitude of things, sometimes depending on the condition. Not everything is an apparent, right?
Right.
And definitely this isn't something the emergency room doctor is going to be diagnosed. I see
Right.
a lot of times people have the pain, they go to the ER. The ER doctor is not there equipped for this particular diagnosis. People may go there because they're having a bout of pain, and the ER, rightfully so, should evaluate why you're having pain. Is it something acute that we can manage now, or is this more chronic nature, right? And so I tell people, be patient with your body, be patient with your healthcare providers. When you think about certain conditions, probably most notably something like lupus, you can't go and get a diagnosis for lupus in the ER or in one visit. Those things evolve over time, and they begin to manifest where we can put your clinical picture together to properly, because I'm a person, I want you properly diagnosed because I want you on the proper and accurate medications for your condition.
And so this runs home that same point that we spoke so much about in COVID. This is why you have to have a primary care doctor. Ladies, you must have an OBGYN. What age would you suggest that girls or women have start seeing an OBGYN?
So that varies. I'm asked that quite often. I personally, as long as they're healthy, there's nothing going on with their health, right? There are some girls that I may have to see earlier, but typically, I want to make sure they're understanding things about their body, whether it's anatomy, whether it's questions around their menstrual cycle. It could be hygiene. All right. I'm beginning to talk about the kind of really their reproductive health. And it's important for me to understand that even adolescents get off to a good start on the foundational knowledge. Because I
Right.
talk to women all the time. If you, as parents, and you don't get them in to see a healthcare professional, even if you as the parent are not wanting to explore those conversations yet, you want them to get it from sound advice, because otherwise they will start asking others questions. They're listening. They're
Mm-hmm.
curious. They'll start asking their friends. I mean, we want them rooted in sound, right? Evidence-based um, information, and not necessarily, as women, we always have to deal with wives' tales and
Yeah.
the
Google and
yeah,
and then
yeah,
now they would have the friends at school and
right. I mean, and then it could even come from our own family, our grandmothers,
right.
what they knew to be true, right, or what they thought to be true.
Right.
What I remember as a young girl, like, you couldn't bathe on your menstrual cycle. I'm like, where did that come from? I know, like, if there's one time I got,
Right. You need a couple baths maybe a day.
right. So those things get passed on. Those are generational, right? And so we have to make sure that we're rooted, in good evidence, what's current, right? Right? Because we have learned things that have made things better for us in
Right.
generations to come. And that's important.
So your internet's paused and so we missed the age you suggested?
So the age I suggest is by 15 to 16. I think
Gotcha.
adolescents, I believe adolescent healthcare and getting adolescents information quickly that's trusted is so important.
Yes, definitely, definitely. So, then the other thing is, I think that we can't talk about enough is when you say dysmenorrhea. I think that for so many years and so many generations and decades, people just were going through like, oh, it's my period. I'm supposed to be in pain, but not debilitating pain. And so I think that if there's something you can talk about just so that the moms know what to tell their daughters or something so that they can understand there is a difference between regular cramps and you might have fibroids, endometriosis, infection, or something else.
That's true. And I just want to be clear when we talk about the spectrum, it's like nothing else. I'll tell you, even in childbirth. There are some women screaming at the very first second contraction, right? Like
Right.
I have seen women, I had one patient, and I'll never forget it. You remember the glass door in the den? She slipped on one of her kids' toys and lacerated the arm, and we had to operate. And she was like, she didn't even need anesthesia. She was like, do y'all have to give me anything? Just sew it up. Right. So there are thresholds of pain,
Right.
and we have to respect that. And so childbirth for her was nothing. She
Mm-hmm.
wouldn't feel anything until the baby was getting ready. Contractions just didn't bother her. So
Wow.
baby about to deliver for a person like that. So I've seen that.
Mm-hmm.
They don't really feel it, right?
Right.
Same thing with cramps. There are some people that don't even know what a cramp is, right? Most of us, the averages have it, and some people's cramps are worse than others. And some people will just have that with nothing else physically that I can see. Endometriosis, fibroid cysts, they just have that. And then a section of those people, a subset, may have endometriosis, may have fibroids, may have scar tissue, may have other things. So again, it's a variation there. And I think people have to respect variations within their body and that there will be variations of the body, right?
Mm-hmm.
So when we talk about painful menstruation, yes, we want people to intervene, mothers, if it's young girls. I mean, I was that person. I remember in college, I never missed school. The only
Right.
time I missed school would be because the first day of my period would be so bad, right?
Gotcha.
But
Yeah.
even as I got older in my mid 20s, they got better. And that can be the case. The earlier we are, usually when you first started having menstrual cycles, the cramps can be worse. So there
Mm-hmm.
is natural evolution for some of us where they get better, and some people may start out there. So there is so much individual variation. That's why I find it so useful and important. Get with your doctor, your nurse practitioner, whoever your healthcare provider is. Trust them, seek them, right? Of course, we know there are things such as heat therapy, anti-inflammatory, such as ibuprofen, things like that that people use, Pamprin, Midol. So yes, if you have an adolescent or a young woman, even a college student, they're having that. Yes, they should be supportively using something, right? Because cramps are one of those things that's very important for women to understand. If you allow cramps to get up to a 10, it's hard to back them down.
Right.
Cramps always are better if you'll try to suppress them early and keep them down versus allowing them to escalate.
I
So,
tell everyone I pregame.
yes,
So I know it's coming. I can feel like a slight twinge. So I just start taking my naproxen then. And then when it comes in, because I'm a heavy bleeder and it will come and it'll try to knock you out for those first 3 days.
yes.
But as long as I pregame, then I'm like, oh, I'm good. Nice smooth on sailing, sail right on through.
Absolutely. And that's a technique we definitely want people to employ and we recommend. When you know your cycles, especially when you know you have bad cramps, get on
Mm-hmm.
top of it. If you know my cycle is going to start the next day, pre medicate the night before, right? You go to bed. It's very important. But I think you're raising a great point today. Not everyone with painful cycles has endometriosis. There is a difference. It's important to be evaluated properly and understand that that evaluation may take time, and it could be a year or two before people are diagnosed at times, just because of the nature of their disease. Not everybody has a rapidly evolving picture.
Right. Yeah. So if you take nothing away from today, everyone, please make certain that you definitely have the right people on your team. So you want to make sure if your daughter, niece, goddaughter, whatever young lady in your life, 15 or 16, make sure she establishes care with an OBGYN so that they can get, just a baseline, figuring out what's going on. They can get questions answered. Just a clear understanding of everything that's going to happen to their body or that is happening to their bodies, because it's so important. And like she said, you do not want to treat this in the ER. So therefore, if you are having painful menstrual cycles, you should go to the doctor, talk to the doctor about it, because they can get you, first of all, they'll get you a diagnosis faster than going to the ER every month is. That's just, even if you went to the same ER every month, it's not going to get you a diagnosis any faster.
It will not.
It's not going to work. So you need to make sure that you are going to a physician and that is specialized in this, that can figure out what is going on. There is no reason that anybody should not be able to go to work, go to school,
Right.
go to whatever. You shouldn't have to stop life because you are having your menstrual cycle. So if you're in that much pain, bells are ringing, you should please go to the doctor. Don't sit there and, just plow through it and miss school every month. That's just silly. It's unnecessary. If you know that there's a problem, you should address the problem. And does Planned Parenthood, do they take care of, would they be able to refer? Okay, that's what I thought.
Yeah, they would absolutely be. So while we think of Planned Parenthood around contraception, but at least you could get a pelvic exam there.
Yeah,
You could get an evaluation, and then they would determine, if there's not an OB-GYN there at that particular location, if you could go and get in with an OB-GYN who could fully and thoroughly evaluate you.
Yeah, that's what I thought. So there are options out there.
Right.
Planned Parenthood being one of them. So please don't let anything be a barrier to you getting your health care. Like she said, NMA is trying to get rid of these health disparities. And so hopefully we can all be on the same level playing field and everyone can have the same type of care. And, everyone can be diagnosed with whatever it is that they have and they can get the treatments that they need. So is there any last thoughts that you have that we need to know about endometriosis?
Endometriosis, there are treatments available. I think that's really important. I think it's important because, anytime people are diagnosed with a chronic condition, we know that they can have increased rates of depression, right? And so it's really important to remain optimistic. The first treatment may not work. Sometimes we have to try different alternative remedies. And so surgery may or may not be curative anytime you're operating for anything around pain, because it can be multifactorial, meaning multiple factors can be contributing to pain. And so I think that, again, finding a healthcare provider that you trust in women's healthcare, specifically if it is endometriosis. And I think you said it well, ensuring that you have that consistent follow up and knowing that there are treatment options.
Thank you so much for your time. We greatly appreciate it. And I know we'll see you again, but thank you again. And everyone, we'll see you next time.
Bye.